Hello, and welcome to the second annual Bounty of Health Virtual Education Series for 2021, hosted by the Office of Community Health and Planning and the Consortium for a Healthier Miami-Dade. During this video, we will hear from local Miami-Dade County health providers and organizations on 10 different community health topics. The health topics will cover issues important to the community, such as COVID-19 vaccines, healthy aging, nutrition, physical activity, stress and self-care, blood sugar, maternal child health, Journey to Wellness prescription, health equity, and tobacco cessation and resources. This video is part of the Bounty of Health drive-thru food distribution being held on Thursday, November 18th, 2021, from 9 a.m. to 12 p.m. at the West Perrine Health Center, located at 18255 Homestead Avenue, Miami, Florida 33157. This will be a first-come, first-served drive-thru event designed to meet the needs of the community during the holiday period. The first 250 cars will receive fresh produce and other goods, along with other giveaways from organizations throughout Miami-Dade County. When you watch this video, you will not only learn about important health topics, but you will also have an opportunity to earn extra giveaways at the drive-thru. Throughout this video, there will be a series of buzzwords. When you see a buzzword, pause the video and write down the word. When you attend the drive-thru the next day, please bring a piece of paper with each of the buzzwords written down and hold it up while in line. You will then receive an extra bag filled with giveaways. Thank you again for joining us for this virtual education session. Enjoy.
Take a moment now to write down the first buzzword during this series. When you see a buzzword, pause the video and write down the word. The buzzword is apple.
Hello, my name is Moses Allen, and I'm Vice President of Pharmacy Operations at Sunshine Health. I'm a pharmacist by training, and as Vice President of Pharmacy Operations, I lead the implementation of the health plans, policies, and goals for our members' pharmacy services. I'm honored to join all of you virtually for the second annual Bounty of Health Drive through food distribution and educational event. Sunshine Health is one of the largest health plans in Florida. We offer health plans for every stage of life that fit in your budget, like and better from Sunshine Health, a health insurance marketplace option available to individuals and families. With the health insurance marketplace open enrollment available now through January 15th, make sure you and your loved ones have the health plan coverage you need and deserve. Having health insurance provides peace of mind and helps families focus on their health. If you'd like to learn more, please visit us at andbetterfl.com. I will preface this conversation by stating that I'm a pharmacist and not a medical doctor. If you have any questions about the vaccine, please speak directly to your doctor. You can visit the Centers for Disease Control website at cdc.gov, which provides the latest information about COVID-19 and the vaccine. As a doctor of pharmacy, a dad, a husband, and community leader, I can tell you why getting the COVID-19 vaccine is so important. I'm sure you've heard about the COVID-19 virus variants and breakthrough cases where some people who have already been vaccinated have gotten COVID-19. You may be asking yourself, why would I get the vaccine if vaccinated people are still getting COVID? Well, it's simple. The vaccine helps reduce the risk of spreading the virus to those around you. Even if you already had COVID-19, you can still get it again. And yes, although we are seeing people test positive for COVID-19 despite being fully vaccinated, those cases are far milder than COVID-19 in unvaccinated people. More than 180 million people are fully vaccinated in the United States. Despite all the pros of the COVID-19 vaccine, there is still a lot of vaccination hesitancy. We know some hesitancy is because some felt the emergency testing was rushed. The fact that vaccines were approved on an emergency basis doesn't mean that shortcuts were taken that make them less safe. All 3 U.S. vaccines were originally approved for emergency use by top medical experts and the FDA. To receive emergency approval, extra steps and guidelines need to be taken. The Pfizer vaccine has received full approval for ages 16 and older and emergency use authorizations for people for ages 5 to 15. There are some people who are hesitant to get the vaccine because they believe it will make them sick with the COVID-19 virus. None of the authorized COVID-19 vaccines in the United States contain the live virus. The COVID-19 vaccine cannot make you sick with the COVID-19 virus. When you do receive your vaccine, you can experience some side effects, which are normal signs that your body is building the protection that it needs to fight the virus. In most cases, these side effects go away within a few days, and some people have no side effects at all. We're seeing a prevalence of vaccination hesitancy in the Black, Hispanic, and other minority populations. I understand the history between minorities and healthcare, including the systemic challenges and inequities in assessing healthcare these groups have faced. However, many of our essential workers on the front lines during the pandemic, such as first responders and grocery store or delivery service workers, belong in these groups. It's critical for workers serving the public to receive their vaccine to protect themselves, their loved ones, and others. In fact, Sunshine Health is requiring all employees to get vaccinated, whether we are on the front lines or not. Now, let's talk about kids and COVID-19 vaccines. As a father of 2 boys, ages 13 and 11, keeping my children safe are my #1 priority during the pandemic. One challenge has been managing a household with both vaccine eligible and ineligible people in it. So what should parents do? A few ways the CDC recommends to protect your unvaccinated family members and children is, #1, get the COVID vaccine yourself. #2, everyone should wear a mask in public. The mask can help maximize protection against the Delta variant and prevent possible spreading it to others. And #3, please don't put a mask on children under the age of 2. Remember, COVID-19 vaccines are available for everyone at no cost, regardless of insurance status. Beware if someone is asking you to pay for access to a COVID-19 vaccine, it's probably a scam. If you're having trouble locating a vaccine, the CDC offers a vaccine locator so you can easily find a location near you at vaccines.gov. Do not wait. It's too late when you're in a hospital on a ventilator. Remember, we're all in this together. Protect yourself and your loved ones by getting vaccinated today.
Hello, everyone, and welcome to this year's Bounty of Health. My name is Ada, and I'm a community health educator with Miami-Dade AHEC, which is a nonprofit organization that provides free health education programs to the community. Today, I get to talk to you about healthy aging, so let's get right into it. What is healthy aging? Well, it's a process in which we optimize our opportunities so that we can maintain and improve our physical and mental health, our independence, and our quality of life. Aging is one of the greatest achievements of mankind. It allows us to grow and to learn new things that we can share with those around us. As an integral part of our communities, older adults age 60 and up make up over 15% of the US population. But as we age, we also increase our risks for developing chronic diseases such as diabetes, hypertension, dementia, and many others. So how can we ensure that we're living in the best way possible so that we can enjoy all the things that life has to offer? Well, we do this by adopting healthy habits and behaviors while also having a little fun. Things like staying active, feeding our bodies, taking care of our brains, getting medical care, etc., are all things that will help us live our best lives. While our environment and the spaces where we live do have an impact on our health, we can't always control them, but we can control what we do and how we live. So let's go over some simple tips for healthy aging. First, we got to get up and move. Getting older doesn't mean we slow down. Whether it's walking or dancing or anything in between, physical activity is one of the foundations of all healthy aging programs. Regular physical activity has been proven to help us live longer and better. It not only helps reduce our risks for developing many health problems, but it also helps us manage them more effectively. If you're just starting out, make sure you start slow and build up more activity over time. And remember that all sorts of activities count, from regular chores to things that we may enjoy, like golfing or gardening. Nourishing our body is super important. Our nutritional needs change at each stage in our lives. Small changes can help us enjoy the things we eat and drink to meet our nutritional needs, as well as help us maintain a healthy body weight and reduce our risk for chronic diseases. Be sure to color your plate and eat a variety of foods. Make sure you get enough protein, dietary fiber, vitamin D, calcium, and potassium, while reducing your intake of added sugars, saturated fats, and salts. You also want to stay hydrated. Talk to a healthcare professional that can help you read and understand food labels so that you can make the healthiest choices for your body's needs. Medical providers and registered dietitians can help us determine our own unique nutritional needs and provide us with specific recommendations that meet our lifestyles. Understand brain health. The way we live our lives has a profound effect on our brain health, from what we eat and drink to how we sleep. Everything we do is critically important to our brain health. A growing body of evidence is showing us that we can reduce our risk of cognitive decline by making important lifestyle changes. So let's look at 10 ways we can show some love to our brains. Exercise and food are at the core of brain health. Evidence has shown that diseases that affect our heart, like high blood pressure and diabetes, can negatively affect our brain health. So it's important to manage our risk factors. Smoking can also negatively affect our brain health and increase our risk for cardiovascular diseases. So if you smoke, consider quitting and connect to resources within your community. Make sure that you're getting enough sleep, as conditions such as insomnia and sleep apnea may cause problems with memory and thinking. Don't forget to protect your brain against traumatic brain injuries by always wearing your seatbelts and helmets and taking steps to prevent slip and falls. Formal education is not just for the young, and we're never too old to learn something new. Reduce your risk of cognitive decline and dementia by taking a course at your local college, community center, or even online. Remember that your mental health is just as important as your physical health. Manage your stress and talk to your doctor if you have any symptoms of depression, anxiety, or other mental health concerns. Challenge yourself by playing games that make you think strategically, play an instrument, or create or build something. These activities have been shown to have both short-term and long-term benefits for your brain. And lastly, stay social. Volunteer at your local community center or animal shelter. Engaging in these meaningful activities may help support brain health. Also, locate benefits and find care. Preventative care, such as annual checkups, screenings, and vaccinations, help us take care of and understand our bodies. If you need help locating benefits or looking for medical providers in your area that provide quality care, you can contact any of the many organizations represented here today to help you get connected. You can also visit www.benefits.gov to find benefits you may qualify for. Manage your medications and treatments. For those of us living with any medical conditions, keeping them under control is important in helping us live better and longer. Make sure you take your medications as prescribed by your doctor, and don't forget to talk to them or ask questions if you're unsure about the medications or you are experiencing any unwanted side effects. And finally, stay connected. Did you know that participating in activities that we enjoy and socializing is great for our health? Well, research shows that when we are social, generous, and goal-oriented, we are happier and experience lower levels of depression. So get out there and enjoy your life with those around you. Be sure to use proper precautions during these times. Wear your mask, keep some distance, gather in open spaces, wash your hands, and consider getting vaccinated if you haven't done so. On behalf of Miami-Dade AHEC, I want to thank you for spending some time with us. You can visit our website or call us for more information on our free health education programs. We look forward to hearing from you. Enjoy the holidays and be safe.
The second buzzword is corn.
Hi everyone, thank you for joining in on the Bounty of Health virtual education series. My name is Carla Sabugo and I'm the Director of Innovation and Outreach for the Miami-Dade County Women, Infants, and Children Program, also known as WIC. I'm a registered and licensed dietitian, nutritionist, and a certified lactation counselor. I'm a mother of 4 active young children, so I know the challenges that come with raising a family. Today I want to talk to you all about how WIC can help your family. We know raising a family can be challenging, especially these days. It really does take a village, and that's where WIC comes in. Miami-Dade WIC is here to help by giving your family a healthy start. WIC offers a variety of services designed to help you and your family live a healthy life. learned a little bit about WIC, let's begin with some nutrition tips for women during pregnancy and after giving birth. Keeping a healthy lifestyle throughout pregnancy as well as before and after is key for both baby and mother. Important steps to a healthy pregnancy include eating a balanced diet, limiting foods and beverages higher in added sugars, saturated fats, and sodium, gaining the right amount of weight, enjoying regular physical activity, taking a vitamin and mineral supplement, and avoiding alcohol, tobacco, and other harmful substances. You might be wondering, what is a balanced diet? Moms-to-be and breastfeeding moms need a variety of foods from all of the MyPlate food groups. A balanced eating plan with a variety of foods can provide healthy women with enough nutrients for pregnancy and after giving birth. Safe food practices are important too, since pregnant women are at a higher risk for food poisoning. Take a moment to pause this video to get a good look at this food chart. Pregnant and postpartum women should be consuming healthy foods from all the food groups listed on this picture. To get a personalized MyPlate plan, visit myplate.gov or download the app. Your healthcare provider may recommend taking a prenatal or postpartum vitamin and mineral supplement in addition to eating a healthy, balanced diet. A few key nutrients during pregnancies are folic acid, also called folate. It's an important B vitamin that reduces the risk of birth defects that affect the spinal cord and brain. All women of childbearing age and pregnant women should consume at least 400 micrograms each day in addition to a healthy diet. Another key nutrient is iron. When you're pregnant, you need about twice the amount of iron as you did before you were expecting, because your body uses iron to make extra blood for your baby. And yet about 50% of pregnant women don't get enough of this important mineral. Another nutrient to keep in mind is calcium. During pregnancy, calcium is needed for the healthy development of a baby's teeth, bones, heart, nerves, and muscles. When a pregnant woman does not consume enough calcium, it is taken from her bones for the baby. It is important to consume adequate amounts of calcium daily before, during, and after pregnancy. Now that we've gone over some healthy nutrition tips for women before, during, and after pregnancy, I'd like to share some information on feeding your baby after birth. Learning about feeding your baby is important, and not just for the mom, but for the father, partner, and family who are part of your support network. You might have heard about the benefits of breastfeeding your baby. Breastfeeding gives your baby the nutrition they need from the very first moments. Health benefits for the baby include lowering baby's risk of certain infections and diseases, including ear infections, asthma, lower respiratory infections, diarrhea and vomiting, childhood obesity, eczema, type 2 diabetes, childhood leukemia, and SIDS. For moms, breastfeeding can help you recover quickly after birth. It can also reduce your risk for certain breast and ovarian cancer and type 2 diabetes. Breastfeeding may also help you lose weight after childbirth. But you may have a lot of questions. That's okay. WIC is here to help every step of the way. Remember that every mom and baby is different, and your breastfeeding journey will be unique. While you'll be learning throughout your journey, the more you learn before your baby's birth, the better prepared you'll be. Here's some important steps you will want to do right from the start. Talk to your medical provider, midwife, or doula about breastfeeding while you are pregnant to discuss your plans. Breastfeeding in the first hour after birth is good for you and for baby. Once your baby is born, their suckling releases hormones in your body that causes your breast to make and release milk. Your breast will provide the exact amount the baby needs. The first milk your baby will need and get from your breast is colostrum. This is the thick first milk your breast makes while you are pregnant and just after birth. Moms and doctors may refer to it as liquid gold for its deep yellow color and because it is so valuable for your baby. Colostrum is very rich in nutrients and has antibodies to protect your baby from infections. Colostrum also helps your baby's digestive system grow and work well. Another step to take is skin to skin. Put your baby's skin with no clothes next to your skin with no clothes. Remember, this will help with bonding and getting your milk hormones going. It also helps with so much more, like regulating the baby's temperature and soothing the baby. Let dad or your partner do this as well. Your baby helps you make milk by suckling and removing milk from the breast. Remember, the more milk the baby drinks, the more milk your body will make. Frequent breastfeeding or milk removal, about 8 to 12 times or more every 24 hours, especially in the first few days and weeks of your baby's life, helps you make a good milk supply. If you're on WIC, let them know you've had your baby and get in touch with your breastfeeding peer counselor. If you aren't on WIC just yet, give them a call to make your appointment. Right now, most services can be done over the phone. Our phone number for appointments is 786-336-1300. And to call your breastfeeding peer counselor, which is a mom just like you that has breastfed their children, call them at 786-336-1336. You might be wondering how to apply for the WIC program. First, let's recap who is eligible for WIC. Women who are pregnant, breastfeeding, or recently postpartum, infants, and children up to the age of 5. Many people don't know WIC continues until the age of 5. Many working families qualify for WIC. We welcome migrant families, fathers, supportive partners, military families, foster parents, and legal guardians with eligible children. To qualify, you must live in Florida, be income eligible. Legal residency or citizenship is not required to participate in the WIC program. WIC provides several services including personalized nutrition counseling, breastfeeding support and education, free healthy foods and an EBT card, and referrals to healthcare and community services. To make your appointment, simply call 786-336-1300 to schedule your WIC appointment at one of our 15 WIC locations in Miami-Dade County. WIC is currently providing most services over the phone, so you do not need to come into one of our WIC centers to receive your benefits. However, all WIC centers are open for in-person services as well. WIC welcomes all. Call us and make your appointment today, or visit our website, miamidadewic.org, for more information. Make sure to follow us on social media at Miami-Dade WIC for our latest updates. We thank you for your time and hope you've learned more about WIC, nutrition, and breastfeeding.
Hi, I am Coach Tito and I work for Baptist Health, specifically at West Kendall Baptist Hospital. My job as a wellness coach, it is to promote and encourage employees to take care of their health by staying physically active. Today, I am going to tell you how to stay physically active. I know this past year or the last 2 years have been very difficult for many of us as far as trying to stay active and doing exercise. You may still be uncertain about going back to the gym or doing group type of activities. Do not worry. There are still different ways to stay active, and one very simple way that I think everybody has great access to it is to start walking. There are so many benefits of walking. I'm gonna go over some of them. 1, boost of energy. Do you know that walking can be your natural coffee? I know many people drink coffee to get that boost of energy, but walking can do the same. Try it out. Maybe you can do a walk in the morning before going to work. 2, it can strengthen your heart. Everybody, I think, knows by now the benefit of exercise to keep your heart healthy and strong. Walking can do that for you. It can also help you breathe better. There is another great benefit that I know everybody is thinking about: reducing stress. Walking can help reduce that stress that we tend to accumulate, and we have to find a healthy way of reducing and getting rid of that accumulated stress. Another great benefit it reduces the effects of sitting down for a long time. By sitting down for hours, you are more likely to accumulate fat weight. Walking can definitely diminish the chances of gaining fat weight. And I'm gonna give you a bonus benefit of walking. You know that walking can help curb chocolate craving or sweet craving. If you have a sweet tooth, you definitely wanna try to go for a 15-minute walk. Now I'm gonna just remind you that you still wanna stay safe when you go walking. You wanna make sure you wear your sunblock, you stay hydrated, and you can do this gradually. Walking, you don't have to go for an hour from the start. You can think of going for 30 minutes and twice or 3 times a week. You can gradually increase the amount of days that you go for a walk, because you're going to gain momentum from the benefits of walking. The CDC recommends 150 minutes of physical activity. This means that 5 days of 30 minutes of walking will be a great start. But you can do this 1 day at a time, and once you reach a month, you can increase a couple of days more. I'm not telling you to start with 5 days right away. Now, there are other options as far as staying active. You can definitely stay safe and do virtual classes as another option. But again, I really like to encourage everybody to find something that you will enjoy and will keep you active long term. Now, goodbye everyone, and stay active. Hola, yo soy Coach Tito y trabajo para Baptist Health, específicamente en West Kendall Baptist Hospital. Mi trabajo como Wellness Coach es procurar que los empleados se mantengan sanos y activos haciendo diferentes tipos de ejercicio. Hoy quiero hacer lo mismo con ustedes. Yo sé que los últimos 2 años han sido bastante difíciles. Muchas personas aún se sienten nerviosas en cuanto a regresar al gimnasio o hacer actividades físicas en grupo. No se preocupen, yo los entiendo. Hoy quiero motivarlos y decirles que hay un tipo de ejercicio bastante bueno y muy seguro. ¿Cuál es? Caminar. Caminar tiene muchos beneficios para la salud. Voy a mencionar unos cuantos de ellos. Ustedes saben que caminar es un café natural o un cafecito. Caminar nos da energía y es una forma sin acumular calorías. Caminar también nos ayuda a la salud del corazón. Nos mantiene el corazón fuerte y el cuerpo también fuerte. También nos ayuda a respirar mejor, especialmente si logramos caminar al aire libre. El otro beneficio muy importante de caminar es reducir el estrés acumulado. Muchos de nosotros estamos acumulando estrés y la forma en que tratamos de lidiar con ese estrés acumulado es consumiendo calorías innecesarias. Bueno, les quiero decir que caminar es una forma saludable de reducir el estrés y sin subir esas libritas de más. Quiero motivarlos para que traten de buscar la manera de caminar. Puede ser alrededor de un lago como este, o puede ser de pronto cerca de la casa. Procuren buscar la manera de caminar, ya que al sentarse por muchas horas seguidas, eso hace el efecto de acumular grasa de más. Al caminar, reduces el chance de acumular peso de grasa. Ahora, quiero recordarles que hay que mantenerse seguros cuando caminamos. Ya que hay mucho sol, hay que procurar utilizar bloqueador solar. Y muy importante, la hidratación. Procuren tener su agua consigo para mantenerse hidratados. Quiero recordarles que no es necesario caminar por 2 o 3 horas al empezar. El CDC pide 150 minutos de actividad física. Eso quiere decir 30 minutos 5 días a la semana para obtener los beneficios de no subir de peso. Ya con caminar 15 a 30 minutos vas a sentir todos los beneficios de los que mencioné. Trata de empezar 1 día o 2 o 3 días si es algo realístico para ti. Ya luego que llevas una semana, puedes aumentar los días dependiendo del tiempo que tengas. Todos tenemos el tiempo, simplemente hay que buscarlo y procurar hacer el ejercicio, ya sea en la mañana o después del trabajo. Caminar es algo muy sencillo y quiero motivarlos a todos para buscar la manera de caminar. Recuerden, si se mantienen activos, vivirán muchos años de vida más saludables. Por último, cuerpo sano, mente sana.
The third buzzword is cranberry.
My name is Amy Pont. I'm Director of Community Programs for Community Care Plan. Thanks to the COVID pandemic, we have been learning a lot of new terms or catchphrases like quarantine, social distance, Zoom calls, N95 masks, and more. We also know the stress that the COVID-19 pandemic has had on all of us. But self-care is not just another COVID buzzword. It is something everyone should practice daily. In this video, I will discuss self-care, why it's important, steps you can take to incorporate it into your life, and finally, when self-care may not be enough, when do you seek help, and what resources are available? First, let's look at how the World Health Organization and National Institute on Mental Health define self-care. Both have one common theme, that self-care can improve your health and prevent disease, as well as improve your productivity and relationships. One of the most common responses to the suggestion that we take care of ourselves first is that we are busy and don't have the time. It may also feel a little selfish when we think about engaging in self-care. But have you ever been on an airplane and heard the flight attendant say, in the event of an emergency, put the oxygen mask on yourself before helping others? Think of self-care as that oxygen mask. Before we talk about ways to practice self-care in your life, let's take a moment to talk about stress and how it can affect you. When we talk about health, you may know that stress can raise blood pressure, which is harmful to our hearts, as well as increased risk of stroke. Stress can also lower your body's ability to fight infections and cause skin conditions, headaches, weight gain or weight loss from unhealthy eating, and more. Whether you work, are a student, retired, or a stay-at-home parent, stress can affect how productive you are during the day. Feeling stressed and overwhelmed can affect your memory, concentration, and putting off daily tasks. Being sad, moody, angry, or irritable can lead to social isolation or frustrations in our relationships with our partner, family members, and friends. There are 5 different types of self-care. Not everyone needs or will benefit from each of these. The idea is to find what works for you and what you need. Physical self-care includes eating healthy, getting physical activity, and avoiding things like tobacco, excessive alcohol use, and drugs. Cake and cookies may feel good at first, but for the long term, a healthy, balanced diet is best. But of course, you can treat yourself too. Small amounts of dark chocolate have been shown to be good for your mood and body too. Exercise also doesn't have to mean going to a gym or for a run. Gardening, dancing, and taking the dog for a long walk are great options too. So are getting some fresh air and playing with the kids or grandkids. Different personalities can determine how much social interaction you need, but make sure you make time for friends and family. Whether that's an in-person visit or a Zoom or phone call, it is important to resist the urge to isolate yourself from others. Mental self-care helps with that productivity. Do things that help you stimulate your mind. This could be learning a new skill or hobby, reading a book, or doing a crossword puzzle. Positive self-talk is also important. Concentrate on all of your strengths. Remind yourself that you are important and you have value. Whether you practice a particular religion or just acknowledge a higher power, research shows that religion or spirituality improves health and reduces stress. So whether that is attending a religious service, praying at home, meditating, or being mindful of nature, this can be a great self-care strategy. If you are feeling angry, sad, or irritable, expressing these emotions by talking with a partner, close friend, or spiritual advisor can help. It can also mean taking time for yourself to do activities that make you feel re-energized or take you to your happy place. A massage, a bubble bath, or walk on the beach, anyone? Or maybe it's catching up on your favorite TV show or the latest blockbuster you've been wanting to see. Whatever it is, pick something that makes you feel good. This is a list of some common signs of stress. On the left side are symptoms that require you to seek help immediately, whether for yourself or a loved one. These cannot wait. On the right side are common symptoms of stress that we may all have from time to time. But if any of these are interfering with your life or lasting more than a month or two, it is always a good idea to talk with a healthcare professional. Whether you live in Miami-Dade County or anywhere in the U.S., here are some great resources to assist you getting the help you need when you need it. And of course, your primary care healthcare provider is always there to help. On behalf of Community Care Plan and the Heart Community Resource Center, we want to thank you for taking the time to watch our video. Educating yourself is the first step in self-care.
Hi everyone, welcome to Sanitas Medical Center. My name is Alejandra Boker. I am the lead dietitian. For those of you who are not familiar with Sanitas Medical Center, Sanitas is a one-stop shop. Pretty much what you get is primary care physicians, specialty care, lab work, diagnostic testing, all under one roof. Now, if that doesn't spell out convenience, I don't know what does. So if you're curious, please come and visit us at one of our centers. We are actually spread out across the country. We are in Florida, we're in New Jersey, in Connecticut, in Tennessee, and also Texas. So now moving on to a very important topic, a very popular topic, and that is nutrition when it comes to blood sugar control. Now, there's three things that I often recommend to my clients. Now, of course, this is general information, and every person is going to be different, but if there are three things that I can recommend right off the bat to everybody is number one, the amounts of carbohydrates that we consume play a huge impact on our blood sugars. So what I mean by that is if we consume a cup of rice versus a spoonful of rice, of course, the cup of rice is going to affect your blood sugars way more than a spoonful of rice. So that's number one, is taking into consideration the amount of carbohydrate that you consume. Number two is the type of carbohydrate. Now, for those of you who have never heard of the glycemic index, this is a table that gives us an idea of what foods affect us and how they affect us, meaning there are high glycemic index foods. These are the ones that most affect blood sugars. I'm talking about white potatoes, white rice, white bread, white pasta, ripe bananas, things of that nature. And then there are low glycemic index carbohydrates. I'm talking about quinoa, vegetables, nuts and seeds, meats. And then there are the low glycemic index fruits. So out of all of the fruits, the berries would be the best alternative. So that's number two. We mentioned the amount of carbohydrates, we mentioned the type of carbohydrate, and then lastly is the combination that we make when we sit down for a meal. We want to make sure that every time, whether it's breakfast, lunch, and dinner, we have a protein, we have a carbohydrate, and we have a fat. Now, I mentioned the carbohydrates up until this point. So as I mentioned, we have to take into consideration the amount of carbohydrate, but also the type. Now, when we do consume carbohydrates, if you're incorporating the protein and you're incorporating the fat, the impact of that carbohydrate over your blood sugars is a lot less. So what I mean by that is if we compare a person that only has toast, let's say for breakfast, versus someone that has the same amount of toast, but also incorporates egg as the protein and avocado as the fat, that bread, that carbohydrate is going to affect the blood sugars less. So just to recap, we want to make sure that we're focusing on the amount, maybe consuming less. Of course, it depends on what type of medication you're consuming. If you're injecting insulin, we want to definitely be more careful with how quickly we make those changes. But the amount has a huge impact, the type of carbohydrate, and lastly, the combination. Now, what we want here at Sanitas Medical Center is not only for you to feel healthy, be healthy, but also stay healthy long-term, meaning you might come in today with some sort of underlying condition. We want to try to treat it and prevent any future complications down in the future. So if you have any questions and if you want to learn more about Sanitas Medical Center, please visit our website. Our website is www.mysanitas.com. I hope to see you one day at one of our centers. Have a great day.
The fourth buzzword of this series is potato.
Hello, my name is Jennifer Guillen and I work for the Florida Department of Health Preventive Services Family Planning Program. In this presentation, we'll talk about the different services our program offers. Family Planning Services. Our job is to improve women's health before, during, and beyond pregnancy. We provide information on baby spacing, abstinence, avoiding sexual transmitted diseases or infections, STDs or STIs, and birth control methods. These are among the different family planning services we offer. We provide colposcopy services, yearly exams for both women and men. We provide free condoms. We provide birth control choices such as from the contraceptive pills, the depot shot, IUDs, and the next one on insertion. We provide sterilization referrals, STD counseling and treatment, HIV/AIDS testing and counseling, preconception counseling, pregnancy testing, and we also provide the emergency contraception pill. Our prenatal care clinic provides care during pregnancy, prenatal, and after delivery postpartum. Provides linkage to care with sister programs such as WIC, Women, Infant, and Children, and dental services. Provides linkage to care with multiple support partnerships in the community to help reduce poor birth outcomes and improve women's well-being. Clinical services. Public health services are available to all residents and visitors of Florida Department of Health in Miami-Dade County. Citizenship is not a requirement. Services are low cost, sliding fee income determination, bring proof of income in order to qualify for a sliding fee scale discount. We do not deny services due to inability to pay. However, you will still be responsible for any charges associated with your visit. Family planning locations. These are different locations throughout Miami-Dade. We have from West Dade, Westchester area, Florida City, the Health District Center, and Little Haiti. Please call to make your appointment or if you have any additional questions, or you may visit us at our website at miamidade.floridahealth.gov. And thank you for your time during this presentation.
Are you interested in going on a journey to wellness? Well, look no further. The Florida Department of Health in Miami-Dade County is pleased to announce the Journey to Wellness RX prescription. You may be wondering, what is a Journey to Wellness RX? The Journey to Wellness RX is a prescription you can get from a healthcare provider to help you create habits that encourage a healthier lifestyle. It's packed with valuable resources and tips on how to manage your weight, eat healthier, and to quit smoking. Take a look at the Journey to Wellness RX. The front side has recommendations for physical activity that include aerobic and strength training, and provides the website for Miami-Dade County parks, recreation, and open spaces, where you can find local parks and activities in your area. The backside of the Journey to Wellness RX has additional resources and tips to help you be the healthiest version of yourself. Get more information about the Journey to Wellness RX online at healthymiamidade.org/Journey to Wellness RX. If you're a healthcare provider and your organization would like to become a community partner distributor, you can order a free supply of Journey to Wellness RX prescription pads online. Any questions? Please call 305-234-5400, extension 8848. I'm Natushka Murray, Health Services Representative with the Florida Department of Health, encouraging you to make healthy happen, Miami.
The fifth buzzword is pumpkin.
Hello, my name is Sabine Deluge, and I'm a Community Impact Director with the American Heart Association. It's my pleasure to take just a few minutes to share with you about health equity, how it ties into our mission as an organization, and to share some examples of the work that we're doing locally to drive equitable health impact. At the American Heart Association, our mission is to be a relentless force for a world of longer and healthier lives. Everything that we do is grounded in our guiding values, and we aim to be a catalyst to help achieve maximum impact in equitable health and well-being. And when we take a look at cardiovascular disease, we've made great strides. The overall death rate due to cardiovascular disease in the US is down. However, the disparities that remain, or the differences in outcomes that vary by population, are shocking. For example, Black adults are 32% more likely to die from cardiovascular disease when compared to white counterparts. And so the reality is that we see disparities across a multitude of health outcomes. There are disproportionate differences that affect specific populations, sometimes based on race, ethnicity, gender, sexual orientation, geographic location, and even income and education. And everyone deserves the opportunity for a full and healthy life. So that's why we're making an even deeper commitment to place equity at the center of everything that we do. As an organization, we are dedicated to achieving our 2024 impact goal, and that is, as champions for health equity, we will advance cardiovascular health for all, which includes identifying and removing barriers to healthcare access and quality. And so essentially, when we talk about health equity, what we mean is it's a state that would be achieved if all people had the just opportunity to be healthy. It means that we give special attention to the needs of those that are at greatest risk of poor health, because no one should be disadvantaged from achieving their potential because of social position or any other socially defined circumstance. When we look at removing those barriers to health equity, we're looking right now and focusing on three major barriers. So structural racism, which are the systems that are in place that are including policies and norms that perpetuate racial group inequity. Social determinants of health, so those conditions in which people are born and live. These are the places in which we live, learn, work, play, and pray. And then rural health disparities. Rural communities do face unique health challenges, and that includes higher risk factors for chronic disease, fewer economic opportunities, and sometimes the challenge of not having affordable healthcare services locally and within the community. And as we work to drive our impact goal and improve health equity, we've strategically chosen priority areas to focus on. We are reducing the risk of heart disease for women, addressing community needs during the pandemic, working to end e-cigarette and tobacco use. We're providing tools and programs to empower people to lower their blood pressure and improving nutrition security and building mental well-being. And the goal, again, is to help people live healthy and full lives. And there are many ways that we are working to achieve this in South Florida. We're working with community partners at food distributions to provide healthy food and beverage options, resources, PPE, and activities for families and children to address food and nutritional insecurity. We've also supplied local food pantries with refrigeration, increasing the number of families that are served by allowing the pantries to store more food and accept donations of perishable items. We're working with South Florida clinics to increase patient health literacy through educational workshops. We're training clinical staff on cultural competency and establishing self-monitored blood pressure programs by providing cuffs and monitors for patients. During this pandemic, we've provided PPE and educational materials to faith-based organizations and other community partners that are providing testing and vaccinations within the community. And finally, we're working with both Broward and Miami-Dade public schools to update school policies on tobacco and vaping and better support students by providing cessation resources. And these are just a few of the many ways that we're working to improve health equity. And so I encourage all of us to be able to come together, collaborate, and to identify ways in which all of us can be champions for health equity and help create a world of longer and healthier lives. Thank you so much. And I encourage you to visit heart.org for more resources on health and equity. Thank you.
Tobacco-Free Florida AHIC Cessation Program. The Florida Area Health Education Network is an extensive statewide system for health professional education and support founded up to 10 regional area health education centers. Each center is supported by an AHIC program at one of the state's medical schools. This organizational structure enables the AHIC to address and focus on the local healthcare issues. The Florida AHIC network has, over this past decade, addressed the primary healthcare needs of Floridians' most vulnerable population through a series of innovative strategies designed to expand the academic health resources, provide information and support for community providers, influence health professional education, influence the future health professionals workforce. The AHIC work in every county of the state to help reduce the use of tobacco by delivering effective evidence-based tobacco cessation services for tobacco users and training programs for healthcare professionals. Here are the 5 AHIC programs along with the subcontractors and the counties they serve. Our goals are to extend awareness of the Tobacco-Free Florida AHIC Cessation Program to all communities. Tobacco is an addiction with significant adverse health consequences. Effective behavioral and pharmacologic interventions are available to achieve tobacco cessation. Getting the word out is a high priority, which is why I'm speaking to you today. We want everyone in the county to know about the Quit Smoking Now program. Quick facts of tobacco use. Cigarette smoke, the breakdown. There are over 7,000 chemicals and compounds in a cigarette smoke. Hundreds of these chemicals are toxic. 68 to 81 carcinogens reported in mainstream smoke. Cigarette smoking is the leading cause of preventable disease and death in the United States. Here you will find additional data regarding tobacco. Smoking causes cardiovascular disease, stroke, pneumonia, multiple cancers, and many other health issues. Cancer, we're not just talking about lung cancer from cigarettes, but also cervical, bladder, liver, and other cancers. Secondhand smoke, also associated with ear infections, asthma attacks, especially in kids and SIDS. We are here to help you. Tobacco-Free Florida Quit Your Way offers free tools and services to help you get started. Just pick the one that's right for you and you get the support you need. What we offer. In the group counseling setting, every participant receives an individual assessment that involves a review of their smoking history and habits, a nicotine addiction score, medical issues, and measurement of their carbon monoxide baseline level. The counselor gives a full overview of all treatments available, and a mutual agreeable treatment plan is determined. This is not carved in stone. If Plan A does not work, then Plan B is instituted. Be helped to create a quit plan. Set a quit date. Have a patient tell friends and family about plan. Remove all tobacco products. You provide practical counseling. Anticipate challenges and ways to overcome them. Provide social support. We offer supportive clinical environment and help patients identify social support system. An important component of the program is tracking the success rate of our participants. We provide relapse service options for those who may need to re-enter the program. Towards the end of the sessions, we address relapse prevention so that participants have the knowledge, tools, and strategies to avoid relapsing. Let's now discuss other services. We have the phone quit, which is known as the quit line. You get a quit code 24 hours, 7 days a week. 2-week supplies of the nicotine replacement therapy, such as a patch, gum, or lozenge. You get a customized plan. You get 3 calls from the quit coach. The number is 1-877 you can now. You receive a welcome kit. You also get text messages and email support. Another option available is a web quit, which is a free online program. You create a personalized web quit plan. It's private and it's at your own pace. You receive motivational and educational emails sent to you, and you also get free NRT distribution, 2-week supply. Another option available is the individual services, where you get free text messages. You get a free starter kit of patches or gum, email program, and it provides a quit guide. Health benefits after cessation. Some short-term benefits include your food tastes better, the sense of smell returns to normal, everyday activities no longer leave you out of breath, your CO level returns to normal, you improve immune system. Some long-term benefits consist of it lowers the risk of cancer of mouth, throat, and bladder are cut in half after 5 years. The risk of lung cancer drops by half after 10 years. Reduces the risk of coronary heart diseases, drops after a year. The risk of strokes falls to similar to a non-smoker after 2 to 5 years. It reduces the development of COPD. It reduces the risk of infertility. And you annually save roughly from $1,380 to $2,710 a year. And here are some tips to help you quit. When you first try to quit, change your routine. Ask your family, friends, and coworkers for support. Stay in non-smoking areas. Keep yourself busy. Distract yourself from urges to smoke. Plan something enjoyable to do every day. Drink a lot of water and other fluids. Other helpful tips include the use of the 4 Ds. First, delay. The urge will pass whether you smoke or not. Deep breathe. Drink water. Do something to take your mind off smoking. For more information, please see the list of resources listed below. Thank you for your time.
Take a moment now to write down the final buzzword. The final buzzword is turkey.
As a reminder, make sure that you have all the buzzwords that were shared today written down. Please bring them with you on a piece of paper to the second annual Bounty of Health food distribution event on Thursday, November 18th from 9 a.m. to 12 p.m. at the West Perrine Health Center located at 18255 Homestead Avenue, Miami, Florida 33157. Display the paper with the written buzzwords while you are going through the drive-thru. You will then receive an extra goodie bag. Finally, we would like to take a moment to give a special thanks to all of our partners who participated in this virtual education series. Thank you again for joining us, and we hope that you enjoyed the program.